My name is Kevin Spizzarni, and I am the Administrator of Children's Services at Hagera Health. We are a full-service community mental health and behavioral health, as well as substance use and crisis service agency for Wayne County. And we provide a very comprehensive array of services, among many other things. And I am the administrator of our children's services. And we provide, obviously, services for children throughout all of Wayne County. And myself, I'm a father of three younger children. So obviously, I can certainly understand the challenges that all of us have been facing as parents, dealing with this pandemic and dealing with the challenges of parenting as well. So I want to give you a bit of a background on how this training came about, and as well as go over some of the goals of our training today. So we had several parents from different school districts that were talking to us and asking us if we could put on some kind of presentation, as many of the things that we've had during this pandemic have really focused on children. And obviously, as a children's provider, we understand that. But we didn't see a lot focus on parents dealing with their feelings during this time, as well as how they can support their children. So we thought this would be a perfect opportunity to do something like that. I want to give a quick shout out to a couple of my other supervisors, Angela Lucas and Stephanie Stromberger, who helped develop a bit of the information for this training as well. So I always like to start with some of the goals of the presentation, because I think it's important for all of us to kind of know where we're going with this and what our plan is. So part of the ideas, or what we want to try to focus on, is how can we discuss how parents can regulate their emotions and assist their children with regulating their emotions. And we're going to get a bit into that, obviously. How to help parents to cope with their difficult feelings. So trying to help you to deal with the difficult feelings that you may be feeling. Establishing routine and a structure that can assist with regulation of your kids as well as your emotions. And obviously with that, we're kind of pretty far deep into this so far. So I imagine everyone's got some kind of routine, or at least a lack of routine. So my hope is to give you some thoughts and things that maybe you can adjust your routine that may be helpful for you as well. I'm going to try to offer some examples of both calming and activating activities for you and your family that maybe you haven't thought of, or maybe would be helpful for you. So the first thing we're going to talk a bit about is regulation. So we have our regulation and co-regulation. So let me talk a bit about what those are. So emotional regulation, as you can read, is a process where a person is aware of their feelings, they understand, they can name them, they can express them in a healthy and kind of a tolerable way. So for most adults, we have a bit more of ability to do this. So this can be knowing that you're feeling a certain thing in emotion, and you may not let it get the best of you, if you will. You may have coping skills and different things to help you with that. The challenge is younger children and even our adolescents don't have that ability, at least as high as most adults do. Part of that is because of their brain development. There are parts of the brain, we call the neocortex, which is the front of the brain, that helps us to think about our choices, think about long-term things, to think about calming activities. Those things don't really develop, those executive functioning tasks in our brain don't really develop until usually our mid-20s. So there's a reason why our younger children sometimes struggle with this. So part of the opportunity for us as parents is to help our children to regulate their feelings, and that we co-regulate together, and it helps them to feel safe as well. So to kind of give you an example about this, if you're a child and you have a moment where you're feeling overwhelmed, everything feels overwhelming. So the idea is, I'm having a bad day, my life is bad. The feelings define the moment for a lot of children, because they don't have the ability to say, yesterday was actually okay, and tomorrow might be just fine. Maybe I'm just having a bad day today. A lot of children have a challenge with that. And that's kind of where this regulation, where they have difficulty regulating their feelings. So as you can kind of see in this picture, I love this picture. It's really helpful, this infographic. The idea of when they're having a storm, so they're having a really tough day. And when it meets our calm, so they can see that we're regulated, we're calm, and we're in a place to help them, and we're safe, then we can co-regulate together. This can obviously be a challenge sometimes for us as parents when we're not actually doing a great job of regulating our emotions, and we're going to get into that in our next slide. Probably 2 or 3 months into the pandemic, my wife and I, we just started having these moments, and it seemed like it was Thursdays. And on these Thursdays, right around lunchtime, after we'd had many calls in the morning and doing teaching with the kids, it seemed like the two of us just had a moment. Both of us would just look at each other, and you could tell both of us were just incredibly overwhelmed. We would laugh, we would get frustrated. It was just our moment, right, where we were having a hard time regulating. And I know one of the things I actually found peaceful is there was this tree off in the distance, and it had lost all of its leaves, but it was so much higher than all the other trees. Again, this is probably March, April, so spring hadn't quite happened yet. I mean, we are in Michigan here, right? And I would just stare at that tree, and I found just staring at it and wondering, imagining in the summer what it would look like, imagining how big it is, just looking at it in comparison to everything else. Somehow I found some peace in that moment, and it helped me to regulate. And again, we're going to go into some tips, but just to give an example that it can happen with the best of us. I'm a trained therapist. I've been a therapist for 15 years, and I have trouble sometimes regulating my emotions where I just want to go off, and the kids are yelling and screaming, and it could just be one of those moments. So it's really important for us to be able to help regulate our children to do that. And part of that, again, is acknowledging our feelings, honoring them, and not allowing them to define the moment that we're in. So let's talk a bit about ourselves on how do we co-regulate. So how do we regulate ourselves? We're going to get into that too with some self-care, but also how do we co-regulate specifically with the children and people that we work with? So one of those things is modeling self-regulation ourselves, whether our child or teenager, and then showing them how we're doing it. So modeling, right? Parents model their behaviors for children. So one of these things is to label it. So it's okay to tell our children, I'm angry right now. I'm upset. I'm mad, right? That's okay to explain to our children. In fact, it helps them to see that we're human too. And even in this moment of the pandemic, we can do that too. It can also be something like using calming things, like I said, looking off into distance, looking at something greater than yourself. Deep breathing, right? If I had a little more time, I'd probably do an exercise with all of us on deep breathing. I think it's something that we can all do. But a very simple way of doing that is maybe spending 10 seconds for yourself, breathing in through your nose, breathing out through your mouth, doing that 4 or 5 times. Again, you're more than welcome to do that now. Even just doing that, what allows us to do is those calming centers in our brain, so that neocortex in the front, it allows it to start working and thinking about long-term things, helping you to focus on the fact that today is tough, but tomorrow isn't, helping you not to lose your focus and lose who you are in that moment. I mentioned for kids, counting to 10, some of the younger ones especially the ones that are learning to count, they really appreciate that because they have to focus on something. And again, to focus on numbers and counting, they're using the front part of their brain, not allowing those kind of primal parts of their brain kind of take over, those fight, flight, or freeze kind of things take over. It can also be helpful too of redirecting that to a calming activity. And again, we're going to get into that too. It's really important to acknowledge the feeling, even acknowledge the child's feelings. I see you're angry right now. I see you're mad. Let's talk about it, right? But that this moment does not have to define our entire day, our entire week, or entire season of our lives. Another way that we can help is by containing our children's emotions, helping them contain their emotions. So what does that mean? In the moment where they're having those feelings, helping them to hold it. So that could be being warm and nurturing, right? To acknowledge it, right? Sometimes we as parents parents saying, I'm having a really bad day, or I'm really angry. And sometimes we want to say, oh, you're not angry, you're fine. It kind of can be demeaning for anyone when someone tells them how they're feeling. So just acknowledging it, being nurturing, especially for our younger ones, trying to get on their level, maybe getting down lower and asking them how you can help. Using eye contact, getting close, especially in this moment of coronavirus. I think we need more opportunities to be close. Listen empathically. I understand what you're feeling right now. I see that you're angry. I see that you're upset about this. Can be touch, right? Especially knowing how your child feels loved, spending time with them, giving them a hug, patting them on the back. I mean, these are all things just talking about it. I'm already feeling soothed a bit, just expressing it and sharing those types of things too. I think this last one was also important too for parents. So what the idea is setting clear expectations for our kids and reinforcing behaviors that meet those expectations. So what this means is when a child's angry, it doesn't mean, well, they're throwing their toys and breaking things. They're slamming the door as they're adolescents. They're punching the wall. those aren't healthy ways to express anger. It's okay as a parent to set expectations in that moment. I see you're angry. We need to find a different way to express our anger. Throwing your toys is only going to break them. Slamming the door is not helpful. It's not respectful in our house. Let's find another way to do it. And I know in the moment it sounds great, but even when you're doing that with a child, it's helpful. And even when they're out after the moment, when they're not angry anymore, that could be a perfect opportunity to process through, give them other alternatives. What's another way? Because that's not going to work. We can't do that. And then reinforcing when they do it well. So if you have a child that's usually angry and throws the toy, and they sit there and they're about to throw the toy and they look at you and you say, ooh, I see you're angry, but you're thinking of not throwing the toy, and they don't throw the toy, great job, you didn't throw your toy. And even with your teenagers, the time they go upstairs and they don't slam the door, later telling them, you did a great job there. I know you were angry and you respected me by not slamming the door. So it's important too, as parents, we can still set expectations. We just want to acknowledge their feelings as well in a healthy way that they do that too.